Good afternoon, everyone, and welcome to a United Medical ACO's Diabetes Wellness webinar. Today is November 7th. This is our November meeting, and so I have with me today Maureen O'Toole from Dexcom, as well as our own Caroline Weber. So we are going to bring up the presentation just so I can kind of walk you through the normal start to our presentation. So we do these on a monthly basis, and I will present to you our program team. So Kemal Erkan is the chairman and CEO of United Medical ACO. Myself, Donna Gunkel, I am a nurse and the director of clinical integration. Dr. Hundal is one of our endocrinologists in the network, and he is our program director. Caroline is one of our 5 dietitians, and she's here with us today. She is our program coordinator. And then we also have 2 social workers who assist us in the program, Roxana Portlock and Carla Williams. So these diabetes wellness webinar started back in 2020 with the pandemic. We used to do a lot of in-person meetings and group classes. And with the pandemic, we had to look for an alternative way to still get information out to our patients. So that's when we created these. They have been well received. So we do one a month. We have a library out on our website at umusa.net. Where we have under our wellness programs all the information. We have quick tip videos, these videos, as well as a bunch of handouts. We regularly bring in providers within our network who are endocrinology, cardiology, nephrology, podiatry, our social workers. We also bring in some outside presenters such as Maureen, physical therapy, and some others, just so we have well-rounded information for our program. And so with that being said, today we do welcome Maureen to talk to us about continuous glucose monitoring. And then Caroline, you're going to do some presenting at the end from the nutrition perspective, correct?
We have some questions for Maureen just
Okay.
to kind of wrap things
Okay.
up, get a better understanding about CGM use.
All right. So that is how we will present today. So without further ado, we will turn it over to you. And thank you again for being with us today, Maureen.
Thank you. It's been my pleasure to be here, and I am excited to help people learn a little bit about diabetes. This is one of the only disease states that you are getting the news from your doctors, and it's a large amount of information for you to kind of digest, and you have to go home and manage it on your own. And these are ways, if you educate yourself about diabetes, you will have a long, healthy life. So thank you for tuning in and learning a little bit about it today and how you can improve your outcomes. But talking first a little bit about type 2 diabetes, there are currently 37 million people with diabetes in the United States right now, and 90 to 95% of them have type 2 diabetes. And type 2 diabetes is where it develops later in life. And there's a lot of influences on type 2 diabetes. And type 1 diabetes is generally diagnosed early in a lifetime and is due to insulin deficiencies. So a little bit of different causation between the 2 types of diabetes, but type 2 is about 90 to 95% of the patients. Unfortunately, only about 30% of them are utilizing what we call as CGM technology, and that is an acronym for continuous glucose monitors. And we're projecting the percentage of patients by the year 20 in the future, I'm sorry, will be about 50% of the population, and I think it's by 2030. So we would like to see at least 50% of the patients currently diagnosed with type 2 diabetes wearing a CGM by 2025 4 it says here, and we're not even close. But our goal is to get to 100%, because these tools really, really can help you improve your outcomes. Next. So when you think about when you're managing diabetes, you're probably sent home with the glucose monitor and asking you to do some finger sticks, which can be painful, difficult to do, and is cumbersome because you've got to take supplies with you wherever you go. If you look at the measurements of when people are taking a reading from a blood glucose monitor, they generally fall at times prior to meals and first thing in the morning. So there's no information that we generally get from blood glucose finger sticks that really are giving us the full picture. If you look at this first dot on the left, that is a 6 a.m. check. That's the first thing in the morning. And if you're really good about finger sticks, we've got 3 more: before lunch, before dinner, and before bed. So about 4 finger sticks a day really does not give the full picture of how to help yourself treat diabetes better, because all the values are in a specific range prior to meals and fasting. Does not include information about after meals. So next slide, please. When you have information that goes beyond those 4 finger sticks a day, with a continuous glucose monitor, you will get readings every 5 minutes. So it's going to be a slow moving video all day long that gives you feedback about your diet, your food, and your exercise, and sometimes stress levels and medications. This information that you can see with your blood glucose readings is a full picture when you're using continuous glucose monitors. Take, for example, here, the dots on the screen are exactly the same times as what we saw on the previous screen. That gives us a range between 70 and 180. However, we're missing the big picture, as I mentioned. And if you see in the yellow areas, those are times of undetected hyperglycemia. That means too much glucose in your body. And we always want to try to keep you below 180 as a younger patient and below 200. Anything above 200 can cause long-term damage. It's not something urgent right here, right now, but the goal is always to keep you under 200, because anytime that you're not, your blood kind of thickens, and that blood can't get to the very small vessels in your eyes, in your kidneys, and your feet. So it's really important to set 200 and below as a goal for you, and 180 and below for younger patients. But the thing with this is showing you on this graph is that we're missing a lot of the information. And not only are you missing the times when you're going low and maybe when food influences in these 2 high points, but your doctor is as well. So when he does not have more than 4 finger sticks, they generally have to guess how they're going to help you treat your diabetes. With CGM therapy, you get immediate feedback to help you make better decisions, and the continuous glucose monitor data also gives the information to the physician to make better decisions. So next. This is what you're probably seeing sometimes when you've been tracking your blood glucose on a piece of paper with a finger stick and a blood glucose monitor. As you can see here, it's very confusing and really does not give us a lot of information, but it's where we start. Next. The other option is in your tools is to look at your A1C, but unfortunately an A1C is only an average of sugars over a 3-month period. So it's going to take the average of the highest high and the lowest low, and that's where it's going to give you the A1C number. But it's very often missing the information that we need in order to make better decisions, because that is just a point in time. Okay. And with CGM data, you can get full picture data, and it is the best tool to use for managing diabetes because, as you saw on the previous slide, you'll be able to see everything all day long in a slow-moving video, and it makes the invisible visible to you. And being able to make better decisions is the key to success. Next. So, being very aggressive early on in your diagnosis with diabetes can make a big difference for you. If you look at the legacy effect and metabolic memory, if you are over an A1C of 6.5 or higher in the first year of diagnosis, it's associated with a 20% higher risk of micro and macrovascular events. Basically, it's complications caused by diabetes in your heart, in your kidneys, and in your eyes, and many other aspects. We do see a 29% higher risk of mortality as well if your A1C's levels are 7 to 8, less than 8, compared to an A1C of 6.5. So the better control you get early on definitely will make a difference, not only right then, but will carry through for the rest of your life. When you get tight control, we see a 25% reduced risk of microvascular disease, and that is in a 30-year analysis. So that data really does show early intervention and good management is going to help you live a long, healthy life. Next. We talked about this a little bit, but I want to kind of re-emphasize that the prevalence of diabetes is very great and it's growing, and you're not alone, but there's a lot of new tools and new approaches to treating diabetes that is here to help you. You need to work with your providers and your team, with your nutritionists and your CDEs, your certified diabetes educators, and you will get this under control. Next. So, with type 2 diagnosis, we've already talked about how important early action is. But to kind of consider where you're coming from, there's a lot of emotions that go into being diagnosed with diabetes, and it's understandable. It may come out of nowhere and it's really shocking. You don't want to have a long-term disease state, so it can cause denial and anger. But we want to assure you that the diagnosis is not a moral failure. It is just something to do with the mechanics of your body. And the lifestyle doesn't need to change overnight. We're going to set some goals for you, and we work towards those goals. And as you learn, you can learn more and encourage that education to impact your outcomes. The dietary issues are the most common reported concerns in type 2 diabetes, and many make drastic or unsustainable changes right at first to your eating habits, and they're not sustainable. So we want to help you make better diet choices and still enjoy the foods that you like, but for you to understand how the impact it has on your blood glucose levels. And we're going to do that by using a CGM, and hopefully at diagnosis, we will get the diabetes under control and managed. It'll personalize your diabetes management and gives your providers the information they need in order to work as a team. Next. So we kind of talked about these behaviors. It makes the invisible visible. It provides immediate feedback. And we do see that there is a 92% increase in the perception of feeling like you have control of what's going on with your diabetes. If we can work together and have you make the right decisions and you're making behavior changes, you will be successful. Next. So we want type 2 patients. There are some diabetes self-care behaviors and reduced cognitive burden when were reported when they're starting with basal insulin. So we want more effective consultations with HCPs, and CGM can do that for you. And we've talked about the partnership and the relationships. This is where it all comes into play with your HCPs, along with your own self-diabetes care, making the right food choices. We reduce the burden that it may have on the stress levels if you feel more confident for what you're doing. And CGM can do that for you. Next. So these are some comments, and I always like to share personal insights because I feel that people often identify with the struggles that other people are having. And, for example, I felt my mood was improved because I felt I had a sense of control over my life and health. If you aren't feeling like you have control into what you're doing, it's frustrating. CGM can put that control back in your court. So I feel that another one is I feel that I had better control, which gave me more confidence. I definitely made me think a little differently about food. I can't tell you how many times that we put CGM on patients and they are shocked what they see. And I often tell people, don't worry about what you see when you first start a CGM. We want to know that information. Remember, we were talking about making the invisible visible. We want to know so we know what to do. Next. So the emerging data shows evidence of definitely behavior changes, and I'm not going to go through all of these. You can read them at your leisure, but the key to it is bringing about positive behavior changes that is going to help you improve your A1C, and that is through continuous glucose monitoring. Next. So when you use a continuous glucose monitor, it is able to link with several different apps to help you blend it into your life seamlessly. We work with Apple Watch. We can log your medication, your activity. We've upgraded our Bluetooth so that you don't even need to take your phone with you if you're wearing an iPhone. There's a lot of flexibility that we have with CGM, that it can go from just preventing you from having to do finger sticks all the way to providing diabetes insights and information to help you make better decisions. Next. The application of a CGM, and when you get one, please contact the manufacturer of the CGM that you're going to be using. They often will have online support for you and videos on their websites. We also have CDEs and nutritionists that can walk you through it over the phone. And there's also many different instructions provided through your provider, but they are very, very simple to use. If you're going to use the app on the phone, it will teach you how to do it through the app in very easy to follow instructions. You simply just open the applicator, you compress it onto the back of your arm, you push the button. It is applied to the back of your arm. We do include overlays in the box to help you keep it on. And if you put it on the back of your arm as opposed to the outside of your arm, you'll have better success in the longevity of the sensor staying on, because you're not bumping into door jambs or sleeping on it. So be sure to put that sensor on the back of your arm. Okay, it's very easy to do. Next. So early CGM use is the best thing that you can do. Be aware of what your options are. Be aware of what your insurance will cover. And it does vary according to your insurance plan, but generally CGMs are covered if you are on any dose of any insulin at any meal just one time a day. If you're a Medicare patient, they will also cover it for hypoglycemia that occurs either twice in 1 month, and that is a blood glucose level of 54 or below. And they will also cover it if you have had a severe low below 54 that required the assistance of a third person. So if you have hypoglycemia, it's very important for your doctors to know that, and because it will change the way that they are treating. So please let them know if you are having low blood sugars, and a CGM will help you prevent those hypoglycemias, because they have alarms to help you. So with that, we want to have all the knowledge that you can get into better addressing your diabetes, putting you back in the driver's seat, and seeing your glucose numbers in real time start to improve. Next. So, any questions that you have?
Yeah, I just wanted to say that was like a great presentation because it's everything I want to talk to patients about every time we have someone come in with new diagnosis of diabetes or have been using finger sticks for quite some time. There's always like this feeling of shame around their blood sugar numbers, just like I'm not in
Right.
control. And I feel like it really does. The CGM really gives you that better picture of curiosity around your blood sugar and how you're eating and what affects your blood sugar. Like if you've got
Exactly.
bad night of sleep or you're sick, what does your sugar do? So I love what you said about personalization because everybody is so different. Foods impact
Mm-hmm.
your body differently. So I always love when someone comes in at a CGM because we get really personalized in the dietary approach of, okay, let's do a snack at this specific time. Or it's very easy to make individualized approach and recommendations when they have all of that information coming in too.
And,
Um,
that's very true. What applies to one person will not apply to another. And so having that information really personalizes it for what works for that patient. So you need to have the information and know what's there. And if you don't have a continuous glucose monitor, you don't know. So I love that you are personalizing them because it's really helpful.
I know I have several patients who use Dexcom and use all different types of CGMs, but how is Dexcom incorporating, user feedback into any design updates, or if patients had certain concerns, has Dexcom made any adjustments to kind of meet those concerns?
So we do, and is it centering around, I'm sorry, ask me the
Like
first part of that question. Okay.
technology or like the app functioning or making any changes based on patient needs.
Yes, we are always, always, always constantly evaluating our products. If there's a problem with the sensor, we replace everything 100%. We stand behind the quality. But of course, it's technology. You are going to have some things that don't work as what you wanted them to plan. So we do constantly evaluate them. We take those sensors apart. We're looking to improve our quality. Dexcom is known for its accuracy because you're making decisions about your diabetes based off of the Dexcom readings. And it is the most accurate CGM to help you make the right decisions. We are constantly innovating. Since I've been with the company for the last 5 years, we were leaving the Dexcom G5, moving into Dexcom G6. Within 2 years of that, we were designing the Dexcom G7, which we launched, and we listened to people. People wanted a longer sensor, and currently Dexcom is a 10-day sensor, and we are launching our Dexcom G7 15-day sensor at the end of this year.
That's
So
so exciting.
we always want to know what patients need, and we added some features to the G7 that we didn't have on the G6 that is really nice for patient personalization. We have quiet modes that allow the patient, and that was requested by patients, and we incorporated it, to quiet all their alarms with one toggle switch. We have meal logging now, so patients can go back and look at the log to see why their A1Cs are high, and they can look at what their foods were and see where it was high, what did they eat, so they can start modifying their diet. So we love to have feedback. We're constantly innovating.
Awesome. That's awesome.
So, one of the things that I was thinking about though is, you know, kind of what Caroline was saying. A lot of people are nervous about if I'm wearing this, what are people going to think?
Mm-hmm.
So two things. So one, I guess, is what would you say to someone who might be nervous about wearing technology on their body? And also, I've seen things probably in the last year or so where several athletes who have diabetes are actually being spokespeople, right? So they're talking about their journey, and also being an athlete. And several of them you can even see while they're in their sport, right? They're wearing the
Mm-hmm.
CGM. So I was just curious, like, what would you say to someone who may be nervous about wearing that?
I mean, it's understandable, and I often hear this in the teenage population where, they don't want to be looked at as different. They don't want to be perceived as less than. And, it is psychological factors that come into a diabetes diagnosis and understandable. However, I think through education and awareness, like November is Diabetes Awareness Month, I feel that people should educate others on what diabetes is and what it involves. And I feel that that shows more of a community support when they understand about diabetes. There are easy ways to, be more discreet in those situations. Our sensor is indicated for an arm application, but many people will just move that sensor higher up towards their armpit so that their uh, shirts will cover it. And the sensors are very small. They're smaller than a quarter and very thin, so they're very easy to hide. And quite honestly, if you're not wearing a continuous glucose monitor or insulin pumps, your job will be more difficult. And the key is, if you remember back to the presentation, is get control quickly, understand what you can do to improve your outcomes. And without CGM and without wearing that on your body, it's a longer, more difficult journey. So take it easy on yourself and try it wearing it just for 10 days at least. That will provide your doctor a better window, a view of what's going on with you throughout the day. But be open-minded. Try it. I think every single person that I have put a Dexcom on since I've been here 5 years ago has kept it, with the exception of one person. And that was just due to a learning disability. And sometimes I've had to really convince people to put them on. But one of the features about Dexcom deals with hypoglycemia, and I feel very strongly about this. Hypoglycemia can be serious, and 50% of type 2s will have hypoglycemia. So it's important for you to pay attention to that. And a year ago in December, I talked to a 14-year-old who did not want to wear something on her body, did not. And so we waited until the Christmas vacation to put it on because she promised me she would try it for 10 days. And interestingly, 3 days into that session, she had such a severe low at night that her father took about an hour to get her sugars back up into normal range. And the Dexcom warns you 20 minutes before you go low. So even with that low alert alarm, he was woken up in his room on the other side of the house, because you can share the data with a parent, with a neighbor, with your children, and it helps to keep you safe. And if that child had not had that sensor on, there would probably have been a very different outcome. So There's so many benefits to wearing continuous glucose monitors that will help keep you healthy. I know we all want to look beautiful, but you'll look beautiful even if you're wearing a small little sensor on the back of your arm, and you'll be healthy.
Yeah, I know it's probably a year or two, we all had samples to try and insert and try the whole process. And it really was very simple and you really can't notice it. It's not very noticeable at all. But how do you see CGMs fitting kind of into the bigger healthcare ecosystem, like integration into the electronic health records, wearables, or AI technology, all of that stuff?
So the goal is, again, to have 100% of type 2 patients wearing some type of continuous glucose monitor. So we're going to continue to push for that. With regards to technology, we are integrating the data currently with several different electronic medical records so that it can be downloaded very easily and conveniently into your patient's files and are there for reference at later points. We've worked on getting integration with other wearable and health apps on your digital phones, on iPhones, Oura rings. We're always looking for partnerships with other technology to improve outcomes. And we also work with insulin pumps. And what's nice with that is it's called a closed loop system. The Dexcom will take the readings for you. The reading is sent to the insulin pump. Based on that reading, it's going to inject the insulin for the patient so that we have a continuous flow of insulin as if they're a patient without diabetes. So a lot of technology that we're doing to improve accuracy, to convenience, and everything to it. So there's a lot coming down the pipeline, and I believe our administration is really pushing for all patients to be wearing some type of continuous glucose monitor or biosensor within the next 2 years. So lots
Very
of
cool.
technology. Mhm.
So just curious, what is Dexcom doing to make sure that the CGM is accessible to patients in all socioeconomic groups? Because as you mentioned, many insurances cover it, but are there some that don't? Or if a patient doesn't have insurance, are they able to get that, with some kind of assistance?
So yes, the insurance companies are pushing for CGM use in 2025. There's been several insurance changes. For instance, OptumRx, CVS Caremark, Express Scripts, and Aetna all removed the insulin requirement for a continuous glucose monitor. We find that when we put a CGM on a patient earlier on, learning that diet component early on carries them through the progression of the disease, if it does. A lot of people do get control on it. But and I forgot where I was going with that. I'm sorry. What was the question again?
Talking about making it accessible to everyone.
Accessible. Thank you. So the insurance is changing, and we want people to put that on earlier. So yes, the insurance companies are moving towards bringing access earlier on in the disease state. We also have a medical assistance program. We do supply support for patients who may have just lost their job, may have lost their insurance coverage. And we do provide coupons on GoodRx that gives you, I believe, a $250 discount off the top of paying cash for a system. So there's a lot of things that they can use to their advantage depending on, what their needs are. We also did develop a biosensor called Stello. It is different from a G7, but it still has all the same technology. It was kind of designed for pre-diabetes patients that do not qualify for a Dexcom G7. And it does have the readings, but no alarms. And it is something that a patient can search out on their own and educate themselves on. on the stello.com website, and it's also available on Amazon. So it is a biosensor available, and that is a 15-day sensor, and they do get 2 of those when they subscribe for $89. So we're trying to do everything that we can to make it accessible regardless of socioeconomics or in the type of insurance that you have. And if, we're always willing to work with any of the providers as well to see if there's, one-offs that we can help with as well.
And if you were, talking to a patient, what is one tip you might give them to get the most out of their CGM data, regardless of kind of like basics of like blood sugar control? Is there anything that you would, any tips or tricks you would give them?
One, wear the sensor. Ask your doctor about one. I cannot tell you, it will change your life. It will make you feel confident. It will make you more successful. It'll make you feel more healthy. But most importantly, it's going to put you back in control. I think the key to it is educate yourself. Learn from the technology, learn from the Dexcom. It's the best tool that you're going to be able to use to truly digest and understand all the amount of information that you need to know in order to be successful. So wear the CGM or at least try it. And most importantly, work with your provider. Tell him what's going on. He'll be able to see the numbers on the charts and on the reports, but we want to know what's going on with you psychologically. What are your struggles? What are you trying to improve? They are your partner. You meet with them once every couple of months and you get direction. Take what that is, take it home, use your CGM and their advice, and you're going to live a long, happy, healthy life.
I'm just curious, the 14-year-old that you mentioned, is she still wearing the CGM?
Oh yes, there's many stories. There's many stories. One of my counterparts for Dexcom, her son was an engineering student, and his senior year at Penn State did not want to wear a CGM on his body, so he didn't wear one. Believe it or not, a Dexcom employee's son would not wear one. He had a hypoglycemic event. He was found in his room with a blood sugar level of, I think, 36.
My
They
word.
think that he had been unconscious for about 3 hours, and they thought he was going to have brain damage. And he fully recovered by a lot of work from a lot of health professionals. And the next day, he had a Dexcom on him, and he, believe it or not, was able to go to class, graduate. He had his finals were 2 weeks later, and
Oh, wow.
he is definitely wearing a Dexcom and an insulin pump now. So he'll never take it off. And everybody starts realizing how much that they can help. And there's so many stories I can tell you about, but that 14-year-old, she still calls me and kind of upstate me on her progress. And I sold insulin for 25 years, and I had planned on retiring when I hit 62. And I hit 62 in September, and I love my job so much because of what it does and helping patients and talking with patients and hearing their stories that I'm going to keep going. But I love hearing the stories.
It just has this
Especially when they have,
overarching theme of like
yeah.
freedom. You get tons of freedom when you use your CGM. It's awesome.
Oh, it's amazing. It's a big learning process. There's no question about it. But why not have the best tool, to help you do that? You know, I gotta
And the
fuck.
success stories are great too. So,
Oh, there's so
and
many.
couple of those that you gave us, I mean, like you said, they could have ended much differently. And you kind of hope. And so I guess part of the purpose of us bringing Maureen on is so that we can help patients to see the benefit before they have an episode
Right.
of that severity, right? So the goal is to do it and learn it and incorporate it into your life all the time. So
I don't want to be remiss, and I want to mention one more thing, if I may. Diabetes doesn't just affect the person with diabetes. It affects
Yeah.
the whole family. And we were talking about stories, and one of my favorite ones is I met with a gentleman who was probably about 35, and for the first time talking about CGM, and his wife was with him and two of his children, and his wife was pregnant, and he was going to have three children under the age of 5. And when I explained to him about the Dexcom and how it will tell him that he's going low 20 minutes ahead of time, he got tears in his eyes. And I thought, "Well, maybe he wasn't feeling well." I said, "Are you okay? Are you okay?" And he said, "I'm fine. I'm just so happy right now because I go to bed every night and I look at my wife who's worried about me and kisses me goodnight because she never knows if that's going to be the last night that I'm with her. And I'm so afraid that something's going to happen to me at night and I'm going to leave my wife and my kids alone." And he he touched my heart so much that I tell that story often because he now was so happy that his wife didn't have to worry about him and that he was going to be able to see his kids grow and be healthy for them. And it's my favorite story, but it's not even just the patient, it's the whole family. And having a CGM will give them peace of mind because they can follow you with the data and they know that you're getting better because you see the incremental improvements. So just wanted to throw that in there.
Course. Well, thank you. And again, we want to thank you for joining us today. And
My pleasure.
of course. And for our population, so Caroline, if you want to tell us a little bit about what we can expect for December.
December is all centered around the holidays, the big topic that's on the books for most people. We're going to talk about savoring the season, enjoying foods, but in a blood sugar friendly way.
All right. Well, thank you both, and I hope that you have a wonderful weekend and a happy Thanksgiving.
You too. Thank you.
you.
Take care, everybody.
Thank
Bye.
you.
Bye-bye.